All right, continuing with talking about the surveys that have measured the public perception related to mental health, we'll talk a little bit about how those surveys were developed. So what the surveys asked is that is depression a mental illness, or is it part of normal ups and downs of life? Is schizophrenia a mental illness, or is it part of the normal ups and downs of life? Is alcohol dependence a mental illness or part of normal ups and downs? All right, so the survey asks, is major depression most likely the result of one of these four bulleted items here? And what they found was that from the time the survey was given in the 90s to when it was again given in the 2000s, that more people attribute depression to a chemical imbalance in the brain. And we might ask if that could be related to information that we've been sharing about neuroscience, or is that related to information that people are seeing on TV from pharmaceutical company commercials? Then they also asked the same thing for schizophrenia, and again found that from the 90s to the 2000s, more people were responding that schizophrenia had a neurobiological connection and was related to some kind of chemical imbalance in the brain. So from the 90s to the 2000s, something interesting happened with alcohol dependence, and it found that more people were saying that it was related to a chemical imbalance in the brain and also bad character. So from the 1990s to 2006, people were more likely to think that alcohol dependence was related to a chemical imbalance in the brain and also to bad character. Then they asked about some questions about treatment and where someone who's getting treated for major depressions should seek treatment. And from the 90s to the 2000s, fewer people were more likely to list a mental hospital as a place where someone with major depression would be treated. They were more likely to say that a mental hospital should be a place where people with schizophrenia are treated. And they were less likely to say that people who have alcohol dependence should be treated in a mental hospital. So you see some real interesting changes happening from the 90s to the 2000s, especially related to alcohol dependence. In terms of how this affects stigma, what these surveys found were that in the 2000s, that 62% of people were unwilling to work with someone who had schizophrenia, 74% were unwilling to work with someone who had alcohol dependence, not willing to socialize with someone, unwilling to have someone marry into their family with schizophrenia or alcohol dependence, and unwilling to have as a neighbor. So the very last shows the change. All of these just show the final results, but these numbers show the change in perception over time. And what you see is that the folks who were unwilling to have a neighbor with schizophrenia rose considerably from the 90s to the 2000s, and same with alcohol dependence. All right, when you think about all of those issues and the way that the public views mental health issues, and you think about all the need in our community, you might think about how can we have some policy level changes that could impact all of the problems within mental health care at the client level and at the professional level with counseling. So I ask, well, what is a policy exactly? What is a policy, and how could a policy help us? And very succinctly put, a policy is a political response to a public problem. And mental health and mental illness, these are public problems, and a policy drafted to target those is going to have a political edge to it. So then what is the role of politics within counseling? That's a really broad question. It's just something I kind of want you to think about, that if you're going to engage in advocacy at the policy level, then you're going to be dealing with politicians who may or may not agree with you on other aspects of the things that you find to be important in politics. Then on a more micro level, with one-on-one with your clients, you're going to work with clients who politically may not agree with you as well. And so to think a little bit about, especially if you're in a small community or in a very rural environment where lots of people know each other, then the impact of having your political views known publicly. What would be the impact of that on the one-on-one client work that you're doing? But that's not really the focus of what we're talking about right now. What we're focusing on right now is talking about how do we go about developing policy, because that's at that last domain block of ACA's advocacy competencies, is to do advocacy related to policy work. Well, who all is involved in policy? We have people making policies at the local government level, the regional government level, the national government level, and then we even have international organizations such as the World Health Organization or the United Nations that take on issues that relate to policy. In this slide, we're going to talk mainly about national government level, the federal government level of different policies that impact mental health. Here are some factors that are involved in mental health policy. There is that political piece of how people's ideology in terms of what they believe in politically is going to influence how they see particular issues. There's a legal issue, there's an economic issue, there's dollar signs attached to this, and then there's an organizational issue of who's going to implement the policy and who will it affect. Some unique characteristics of mental health policy issues are that like we said earlier, there's a lot of stigma around mental health issues, and that can influence policymakers in the way that they draft legislation, and it can also influence how people carry out legislation. It can also be something that we need to maybe regulate through different types of policies. There's a lot of ambiguity in the field of mental health, of kind of not really being able to predict the course of an illness exactly or predict everyone who will be at risk. There's service complexity. We have a continuum of care. Not everyone receives or needs the same type of treatment. Not everyone needs all the levels of treatment that are available. The system is very, very complex. We've got third-party payers. We've got different types of providers. We've got different types of clients with different resources and needs for themselves. We have the federalism issue in that it is the responsibility of the states to develop policy related to mental health, but then we also have some at the national level, some federal issues and definitely federal spending dollars that influence how those state policies are enacted. And then this last bullet here, the issue attention cycle, that gets into how long of a sustained interest will the public have or will policymakers have in a mental health issue. And like I said at the beginning of this video series, is that there's often a lot of attention right after a tragedy, after the movie theater shootings in Colorado or the horrible shooting in the elementary school in Connecticut. There's a lot of media attention, but then it's short-lived and it's only focused on this tragedy. So we really want to think about, well, how do we keep the attention of policymakers for much longer than a post-tragedy response cycle. When we're doing policy analysis, we really want to be clear about, well, what is the problem, and do we have some real empirical data? Do we have some actual research-supported data and information that will help us to design solutions? And we put all those things in to get together, and then we say, okay, what kind of funding do we need from these policymakers to help us to get so that we can create conditions for positive mental health and to address mental illness? Sometimes some things that go wrong are that people get oversold. The idea gets maybe glossed over as something that's going to just fix and save everything. But as we said, that mental health care is a very complex system, so there's never going to be that magic bullet that fixes everything, because it's just so much complexity. And sometimes we have a policy that goes into effect that's a very good policy, but it doesn't fix everything, and so people don't see it as a good policy when there are actually good aspects of it, but it was maybe oversold in the beginning. Then we also have situations where the initial solution that's developed and put into policy is underfunded, and so it can never be as good or fully realized as it was originally intended to be. And then we also have policies that are great on paper, but when they're implemented, they get watered down or they aren't carried out in the exact manner in which the original policy was intended to. There are lots of government groups, professional associations, and social movement organizations that attempt to influence policy outcomes. We'll talk about the ones that are specific to mental health counseling. And those would be three of the main ones listed here: the American Counseling Association, the American Mental Health Counseling Association, and then NAMI, the National Alliance for the Mentally Ill. ACA and AMCA are two that are focused on professional advocacy. So these are professional membership associations within the field of counseling that lobby and try to be part of that policy level conversation to influence the issues that you see listed here beside their hyperlinks. You can also click on the hyperlinks within the PowerPoint and it'll take you directly to pages that talk a little bit more about each of those. NAMI is a little bit different because this is a grassroots organization for people who have mental illness issues and their family members, and it tries to advocate directly for the people who are impacted by mental illness. So their emphases are slightly different than the counselor provider perspective. So counselors are trying to advocate for the profession by being seen as equitable to other mental health professions and by helping counselors to be able to take their license from one state to the next, licensure portability. But NAMI is trying to create policies that are respectful and attentive to the needs of people who have mental illness. And that can be things related to reproductive rights of those who have mental illness and the right to get custody back of their children after a hospitalization, or who handles a trust when somebody passes away in the will and or loses their power of attorney. So they're much more granular issues that are specific to the needs of the mentally ill. If you want to participate in policy, then what you need to be aware of is the current research that's out there in the field that will help to support your request or what you're trying to advocate for. It's also a good idea to be aligned with a professional association, because then you have the power of the whole association and all of its members and its leadership being able to exercise its muscle power in a much more strong way than an individual can. And while professional associations are great, there's also no substitution for the personal stories of counselors who work with vulnerable populations, who struggle with payment issues or licensure portability issues, to be able to tell their stories. Those are very meaningful to policymakers, and if you ever are in a situation where you're advocating for policy, you really want to draw on the research, have the arm of the muscle of the professional association, but use your personal story. And then finally, we also really need to have people with mental illness participating in the policy process, and that's what makes organizations like NAMI so important. But NAMI is just one organization, so there are others out there that might represent the diversity of ideas within the community of people who have mental illness. I'm going to pause here and pick this up on the next segment of the video series.